Hello guys, welcome to our series of videos on home remedies. Today we have come up with a very important topic on gastroesophageal reflux disease or hyperacidity or acidity, indigestion, heartburn. That's how it's commonly known as. So what will happen if you have hyperacidity? You get pain in the upper stomach. You'll have pain in the chest, burning sensation in the chest. They call it heartburn. Then there will be burning sensation in the throat, or they'll feel there's something stuck in the throat. Some people feel that there is flame stuck all the time and they try to cough it out, and they're with the many unsuccessful attempts. Some of these are the common signs of hyperacidity. So what can be done at home in order to prevent this hyperacidity? There are some do's and don'ts that you have to follow. So what you should not do: number one, avoid taking fatty oily meals. The fatty meals or the oily meals such as the fried cheese makes your acidity worse. You have to avoid taking the fatty things. Number two, avoid taking spicy food. In our setting, people take a lot of spicy, hot, spicy food that worsens the acidity. So take, try to take, boiled food, spicy food. Number three is avoid taking milk and milk products. A lot of people in a setting, they take cheese. Almost all the curry they put cheese. So milk and milk products such as cheese, worsens the acidity. So it is best avoided, especially in empty stomach. It makes the acidity worse. So avoid taking milk and milk products, especially in the empty stomach. Avoid taking citrus fruit like lemon and oranges. They worsen the acidity. Avoid taking tea, coffee. Too much of tea, coffee is not good. Taking a cup or two should be fine, but don't take a lot of tea and coffee if you have hyperacidity. Avoid alcohol. There is a misbelief among the people that alcohol makes the acidity better. So it can be very dangerous, and if there is already a wound there, ulcer there, it can even lead to life-threatening complications. So avoid alcohols. Avoid carbonated drinks and fizzy drinks such as Pepsis and colas. It makes the acidity worse. Discuss about some of the do's. What can be done in order to prevent the acidity? You can elevate the head end of the bed. You can put some bricks or something and elevate the head end. Some people they put pillow, but making the whole bed incline is better than putting a additional pillow, and it is more effective. The next thing is, don't sleep as soon as you eat. Sleep up to 2 to 3 hours after taking your dinner. So if you sleep at 10 p.m., try to take your dinner by 7 p.m. so that whatever you eat, it doesn't press and lead to acid reflux. So give some break. The other thing you can do is, after eating, take a walk for 10-15 minutes outside. A short walk will help in digestion of food and prevent acid reflux. Take small frequent meals. Rather than taking a lot quantity, you have to take a smaller but frequent meals, and don't keep the stomach empty. Take a regular food at regular intervals. The other thing you can do is yoga and exercises. Yoga and exercises not only reduce your weight and help in digestion, but also it will lead to reduction of stress. Stress is one of the main culprit for hyperacidity and acid production. So controlling your stress is very important. So playing sports, doing exercises regularly, even yoga, meditation are an important component of anti-reflux measures. There are certain foods that help in preventing acid reflux, such as banana, ginger. They are said to be helpful. Banana, it leads to coating and prevent the damage by the acid reflux. The other thing is, when you are sleeping, you can sleep in the left side rather than sleeping supine. The food, whatever you eat, will press it down. To try to sleep by the side, especially on the left side, that it has a mechanism whereby the acid reflux is reduced if you sleep by on the left side. So try to sleep on the left side, or even on the right side is fine. But as soon as you eat, you go and sleep like, supine like this, then the acidity is more. So try to sleep by the side. So these are some of the do's and don'ts you can practice at home in order to reduce your acidity. Obviously, at the end of the day, you have to go to the hospital and make sure that it is not some serious disease. You have to go into proper diagnosis and investigation to rule out serious disease. And once you are diagnosed with gastroesophageal reflux disease, then these are the do's and don'ts that you can be done at home.